name is Vivian. I'll be doing the skills video head-to-toe assessment. I'm wearing the correct uniform. I have my stethoscope, I have my name badge, I have my pen light, I have a pair of clean gloves, and I'm wearing the correct shoes. I just don't want to get the house dirty, so I wore the covers for the shoes. But I'm wearing shoes. Trust me on that. I'm also not wearing any jewelry, no acrylic nails, no nail polish, nothing like that. And this is my volunteer.
Hello, my name is Rin Bang. My date of birth is June 19th, 2000, and I consent to participation and to be recorded.
Great. So the first thing I would do before I see my patient is I would go to my patient's door, knock on my patient's door, enter the room, close my patient's door, close my patient's curtain to ensure patient privacy. I will then perform hand hygiene and don my clean gloves. And I would introduce myself to my patient, and then ask my patient for patient verification. Okay, my name is Vivian. I'll be your nurse today. Can I have your full name and date of birth?
My name is Rin Bang. My date of birth is June 19th, 2000.
Okay, I did two patient verification by looking at the wristband. Is the correct patient? So now I'll explain to the patient what we will be doing today. Okay, Mr. Bang, is it okay if I call you Rin?
Yes.
Okay, Rin, you had a tonsillectomy and you were under general anesthesia, so we just want to do a head-to-toe assessment to make sure everything's okay. Is that okay?
Yeah.
Great. Just to let you know, I'm going to be touching your face, your chest, your back, all that stuff. And if you feel uncomfortable or if you feel any pain, please let me know, okay? Great. So the first thing I'm going to do is check my patient's overall demeanor, and my patient is sitting comfortably, he's not in any distress, he is well groomed, and the next thing I would do is check his vital signs, and his vital signs are a heart rate of 65 beats per minute, a blood pressure of 120/80, respiratory rate of 16, temperature of 98.8, and oxygen saturation of 98% on room air. I would also do a pain assessment. So, Rin, from 0 to 10, 10 being the most painful thing you've ever experienced, it's hard for you to talk, how would you rate your pain?
0.
Great. Now we can finally begin the assessment. So the first thing we're going to do with this assessment is check my patient's lips. And my patient's lips are pink, which is a good color compared to his skin. And it's well hydrated. There are no cracks and there is no drooping. So it's all healthy there. Now I'm going to touch your lips, check his gums and his teeth. Teeth and gums are intact, pink and moist. So all good in that front. I'm going to check the inside of your mouth now, and I'm going to check the patient's mucosa and palate. Please open your mouth. Great. Patient's mucosa and palate are intact, pink, moist, all good in that front. Okay, now I'm going to check your tongue and your uvula. So can you please open your mouth, stick your tongue out, and say ah.
Ah.
Okay, great. So, patient's tongue and uvula are midline, and they're pink, they're moist. There's no, so far I have not seen any inflammation, no swelling, no abrasions, nothing like that. And for the last thing, we're going to check the patient's tonsils. Please open your mouth one more time. Great. Patient's tonsils are absent because he had a tonsillectomy. I checked the sides, there's no inflammation, no discharge, nothing like that. And if we have a patient who has tonsils, we want to make sure they're small, symmetrical, and without any white patches or yellow patches. Okay, now we're going to move on from that. We're going to do your nose, okay? So I'm going to touch your nose. If you feel any tenderness or pain, let me know. Palpate the nose. Any pain, tenderness?
No.
Great, okay, so patient is not feeling any pain or tenderness. There's no swelling. There's no abrasions, no discolorations. Nose is symmetrical. Okay, now I'm going to shine a light into your nostrils. So tilt your head back for me. Okay, great. Patient's septum is midline. There's no deviation. And his nares or nostrils, it's pink, it's moist. There's nothing abnormal with these findings. Okay, the next thing I'm going to do is we're going to do a little test. Can you press one finger against your nose, block one airway, and breathe in, breathe out. Okay? chest right now. Breathe in. Breathe out. Great. Nose, patient's nostrils are patent. There's no blockage in airway at all. Okay, and then I'm going to palpate your sinuses, okay? You please let me know if there is any pain or tenderness. Don't be afraid to speak. Any pain or tenderness?
Nope.
Great. There's no pain, tenderness, according to the patient, and I don't feel any swelling, there's no edema, there's no inflammation, and no abrasions. All good on that front. Okay, the next thing we're going to do, now that we've checked all your nose, is we're going to check your ears, okay? So we're going to do a whisper test, and the whisper test is I'm going to say a noun or a number, and you're going to repeat it back to me, okay?
42.
Correct.
April.
April is correct. Okay, so the patient's hearing is intact. Now I'm going to check your ears, okay? The inside of your ears and just your ears in general. So checking ears. Patient's ear is intact, no inflammation, no swelling, no abrasions, nothing like that. Great. No inflammation, no abrasions, no swelling. Okay, and check the inside. It's the same inside. That there's no inflammation, abrasions, nothing like that. No inflammation. Alright. And I also check for any discharge. Both ears are not exhibiting discharge, and the tympanic membrane is intact on both ends. Both are pearly gray. Great. Your ears are good. So now we're going to move to your eyes. For your eyes, I'm going to pull down your eyes right here. More a bit. Sorry, push up a bit. Okay, great. The patient's sclera is white and his conjunctiva is pink. Both are moist and intact. Great. So, and patient's eyes are symmetrical. Patient's eyes are symmetrical. Yes. Yes. Okay, great. Now I am going to shine this light in your eye. Please do not close your eyes, okay? Okay, one side. Great. Other side. Great. Okay, please follow my pen. I'm going to go up here. There we go. Great. Great. So that was a test for our patient's perla, and the patient's pupils are round and reactive to light and accommodation. So patient is good on eyes. Now we're going to go to your neck. So we're going to palpate his lymph nodes. For your lymph nodes, please let me know if you feel any pain, tenderness, any swelling, okay? Any pain, any tenderness?
No.
Great. Patient has indicated that there is no pain, no tenderness, nothing like that, and I did not feel any I did not see any discoloration. There's no lumps, no abrasions, all good. Okay, the next thing I'm going to do is I am going to palpate your trachea, okay? And I'm going to palpate your neck. So, all right. Sure. Okay. Please swallow for me. Great. Trachea is midline, and I do not feel any swelling, no edema, nothing like that. Do you feel any pain or tenderness?
No.
Great. No pain, no tenderness. All right. And then we are going to check for a jugular venous distension. So we're going to check the side. Great. Great. Just checking, just checking. Patient is not exhibiting any signs of jugular venous distension. And then we are going to check your range of motion in your neck. So if you look down for me, look up for me. Great. Can you look left? Can you look right? Okay. Now can you tilt your head to the side? Tilt your head to the side. Roll your neck for me like this. Great. Patient has full range of motion on for his neck. Now I'm going to put my hands on your shoulders, okay? You're going to shrug for me, and you're going to shrug with all your might, and I'm going to push down. Don't let me win. Ready, set, go. Great. Patient has strong shoulder, neck muscles. Now we can proceed to the lungs. Okay, so for the lungs, there's 5 items, and for the first one, we are going to listen. Hear it. Every time I put this down, you're going to breathe in and breathe out. Go ahead. Great. Breathe in. 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 Great. We do that. Breathe in. Great. Breathe in. Great. Breathe in. Okay. 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 One more time. Sorry, another time. Good. Okay. Patient's lung lobes sound clear. There's no crackling, no wheezing, all adventitious lung sounds. There are no other adventitious lung sounds. He is all good for his lungs. Okay, now I am going to put my hand on your chest. You're going to breathe in and out, okay? Go ahead, breathe in, out. Great. We're going to go to your back, breathe in, breathe out. Great. Patient's expansion is level and symmetric. Now we are going to palpate your thorax, okay? So let me know if you feel any tenderness or pain. So I'm palpating your thorax. Any tenderness, any pain?
No.
Patient's thorax has no abnormalities. There is no abrasions that I can see because we don't want our patient to be possibly exposed. And there is no edema, no inflammation, nothing like that. The patient has stated that there is no pain or tenderness. Great. Now, are you experiencing any coughing at all?
No.
Good. And for my patient's breathing, he is breathing unlabored. We have to assess his breathing. His breathing is unlabored, it's even, symmetrical. He's not using his accessory muscles, so he's good on that front. Now we're going to move on to your heart, cardiovascular section. So we're going to palpate your carotid and temporal sinuses, okay, or pulse. Great. Any pain or tenderness?
No.
Great. Patient is not experiencing any pain or tenderness in the location. There's no inflammation, no abrasions, nothing like that. And if we are talking about pulse, it's a good pulse. As well as the next thing we're going to do is listen to your heart. Repeat your heart sound? Okay. Listen to your heart. Strong heart. Okay. S1, S2 noted, no abnormal adventitious heart sounds, all good on that front. Next thing we will do is we're going to check his pulse for his radial, femoral, dorsalis pedis, and his posterior tibialis, all bilaterally. So can I see your wrist? Okay. I would usually count this for a minute or a minute and note rhythm and rate. It is bounding, so we're going to do +3. All right. For your dorsalis pedis. Okay, +2. Posterior tibialis, +2. I'm not going to do the femoral, but we're going to say the femoral is +2. And then after that, we're going to do your abdomen, the patient's abdomen. So if you want to lay down, you can. Preferably, we'd want our patient to lay down. That is how it's supposed to be done. So first, we would inspect the patient's abdomen. We want to make sure that it is not distended, it's flat, that there's no abrasions, no inflammation, nothing like that. I'm not going to expose our patient here, but we would want to expose our patient just to see their stomach. And then I would auscultate the stomach. So usually you want to do this for 5 minutes per quadrant. But for the sake of this video, we're going to pretend I did it for 5 minutes, because I don't think you're going to sit here and watch me do this for 5 minutes. Patient's abdomen is normotensive. He is all good in that front. And then we would go to palpation. For palpation, we want to be gentle to begin with. When we palpate, please let me know if there's any pain or tenderness, okay? And then the second time we do it around, we want to make sure it's harder. We're trying to feel any masses, any lumps, which this patient does not have any that I've felt. We also want to make sure that the patient is not guarding, which he isn't. So he is good on that front. And then after that, we want to, let's see, I've already auscultated, I've palpated, and then, I want to know when you are, if your bowel is normal, if you are experiencing any problems with pain, pooping, or your bowel.
No.
Great. When's the last time you used the bathroom?
A few hours ago.
That's good. Okay, great. So, I just want to make sure. Great, okay, I did everything for that. And then the next thing we're going to do is your musculoskeletal. That one has 2 things. So for this one, it's going to be a little more involved. We're assessing for his strength and his range of motion for his arms, legs, ankles, and his back. So the first thing I want you to do is, sorry, let me think. Okay. You're going to guard. Okay, and then you're going to push, and I'm going to push. Go ahead. Don't let me win. Great. I'm going to pull. Pull. Great. Now, can you put your hands out into a T like this? Can you do it in a circle? Great. Bigger. Great. Now, can you put your hands up? Hands down. Perfect. Okay, now what we're going to do next is we got to do your legs. So we can do it one by one. So I'm going to push on your leg, I'm going to push back, okay? Push. Great. Push. Great. Now can you move your legs in a circle? Great. Do this one. Okay, now we're going to do your foot. So I'm going to do one at a time. So you're going to push, and I'm going to push. You're going to push against my hand. Okay, ready, go. Okay, good. This way. Good. Now can you move your ankle in a circle? And then do that one, please. Great. Now can you please stand? Alright, can you touch your toes for me? Great, now can you go like this for me? Great, any pain, any tenderness at all?
No.
Great, you can sit back down. Patient says he's not feeling any pain or tenderness. Patient has full range of motion for his legs, arms, back, and ankles. We would also want to make sure that the joints have no swelling, so we would look at all his joints, and his joints don't indicate any swelling or inflammation, and the patient has stated he's not in pain or inflammation. So, very good, great. The next thing we're going to do is neurological. I'm pretty sure neurological has 4 items that we have to do. So I'm going to ask you a set of questions. So the first one, do you know your full name?
Yes, Renday.
So you know who you are. Great. What year is it?
2026.
Great. Do you know where you are?
The hospital.
Great. Do you know why you're here?
I had a surgery.
Good. Patient is A&O, or alert and aware. Alert oriented times 4. Okay, and the next thing we're going to do is can you stand up again? I'm so sorry. You're going to have to stand up, and you're going to walk to the end of the carpet, and you're going to walk back. Great, great. Now can you walk heel to toe all the way to the carpet, at the end of the carpet, and walk back? can you stand on your tippy toes and go back to your heel? Nice. Can you put your finger out, touch your nose? Great, great. Patient has good, good and steady gait, good center of gravity, good coordination. Nothing wrong with his coordination. He can follow instructions. And his Glasgow coma scale would have to be 15 out of 15 because the patient's not in coma. He has very good orientation to where he is, what he's doing, etc. And for the Glasgow coma scale, it is meaning to test their eyes and their motor and their, what else? Their neurological, basically. Okay, you can sit back down. Okay, I also want to preface for the cardiovascular section, we were supposed to do a capillary refill. So for capillary refill, we would check their nail beds, press on their nail beds. While it's white, let go, see that the redness would return. We would do that for both their arms, so both their hands, so their fingers. Then we do it for the toes. And the patient has a capillary refill of less than 3, so he's good on that front. He has good capillary refill. Okay, and then for the last one, we're doing hair, skin, and nails. So for that section, there is 7 items for that section, and we're going to just check our patient. We're going to make sure that their skin turgor is good, which it retracts back. It indicates there's no dehydration. Skin turgor is good. Now, we want to make sure that we're inspecting the patient, so we would inspect them head to toe for their skin, hair, and nails. So we're looking at the nails, all the hair, all the skin. Can I see your nails again? I'm so sorry. Okay, so patient is not experiencing any lesions, abrasions, or rashes. Would you also say you are not experiencing any rashes or lesions that you know of? And of course, we would check full body, so we would check the back, we would check the head, all the head, the hair, to make sure he's not experiencing any lesions, abrasions, or rashes. And we also want to make sure he's not experiencing any lumps, lesions, or, I'm trying to remember, abrasions, lesions, lumps, abrasions, or tenderness. You're not feeling any tenderness at all? Great. So we would also want to make sure for the patient that their joints, for the bony prominence, there's no skin breakdown, which we already checked that there's no skin breakdown on the bony prominences, their ankles, so on, and just any joint areas. We would want to make sure that their nails is not dented, and there is no cracks in it, and patient's nail beds look really good, really healthy, smooth, clean, all that. We would also want to make sure that, give me a minute to think, that the patient's hair is not thinning and it's not missing. We are good on that front, and I want to say that's it. I feel like I'm missing one thing. All right, so yeah, I would take off my gloves. Throw it in the trash, perform hand hygiene, and then I would educate my patient. So because you had a tonsillectomy, if you're having any pain, even with medication, if it gets worse, and if you're having pain with medication, please let us know. You're going to have, fever is common, but if the fever does not go away in 2 hours and it's above 101 or just 101, just let us know, please. If you're having any abnormal bleeding, let us know. And my last question for you is, are you comfortable?
Yes.
Great. I'm going to put your call light next to you, and then you're all good to go. If you have any questions, comments, concerns, feel free to hit the call light, and I'll come brush it back to you, okay? Okay, good. So then I would leave the patient close to my patient's door and go document the procedure. Thank you for watching my long video. So sorry.